New research on the Zika virus is speeding up a debate about how to prevent the spread of the disease. One big question facing U.S. health officials is whether the government should recommend that women here in the U.S. avoid getting pregnant if they live in areas where Zika is spreading. And that could potentially include large sections of the U.S. CBS News medical contributor Dr. Holly Phillips is with us. Holly, good morning.
Good morning, Nora.
This is incredible that they're even considering this. This would be unprecedented?
Absolutely unprecedented. Okay, so this is a very politically and ethically charged question. And making such a recommendation that women avoid pregnancy would be entirely unprecedented in the United States. Never before have our federal officials told women in particular regions of the United States not to become pregnant. Now, we have not yet seen local spread via mosquito here in the United States, but everyone says, you know, from the World Health Organization to the CDC to other federal health officials, they all say we will see that happening sometime.
And it now seems that authorities are very, very concerned about this, more so than, and I think if you're a woman of childbearing years, this must be very frightening. I'm curious about who exactly it would affect.
Right.
And are there things that authorities are not telling us? Because the more we hear, it seems the worse this story gets.
Well, you know what? There is more that we don't know about this virus right now than what we do know. So in as much as that type of advice to even consider it is unprecedented, you know, telling women not to become pregnant, the virus itself is unprecedented. This is the first mosquito-transmitted virus that we know of that can cause such severe birth defects or birth defects at all. The Zika virus in women who are becoming pregnant or are pregnant in their first trimester causes microcephaly. This is an underdevelopment of the brain at birth, and it has lifelong effects on the baby.
Back to the recommendation about getting pregnant. Federal officials are divided, or the majority of them one side or the other?
You know, many of them aren't saying at all. Tom Frieden, the director of the CDC, has said this is going to be a very long conversation, and many of the officials who are very important in making such decisions aren't making any statements yet. We really know less about what's going to happen here than we would like to, but I do think it's one of those things that will unfold as more information becomes available.
That sometimes creates panic if you let it unfold and do the deliberations in public. Just my opinion. Yeah.
Thank you, Dr. Holly Phillips.